Hi, I'm Dr. Jonathan McDermed, Scientific Director at Iris Molecular Diagnostics, and I'm pleased to introduce our new Nadia ProsView PSA prognostic test here at AUA. This is our launch of the assay. It was FDA cleared in September of last year, and we've had a lot of good feedback at our booth here. I'd like to tell you a little bit about what Nadia ProsView is. Nadia is actually an analytical system that can measure very low levels of analytes and proteins in blood or body fluids. We developed the PSA test because of the difficulty in measuring PSA with the current assays and the unknown questions that exist with values in that range. Basically, we were able to show that with the PSA test, every patient that has had a prostate removed, we can measure their PSA value quantitatively. And any changes in the PSA value that occur over time can be quantitated and tracked, and a rate of rise calculated. The test has been approved for identifying men who are at very low risk for recurrence of prostate cancer based on a PSA rate of rise less than 2 picograms per ml per month. Patients who have a rate of rise of PSA that is greater than 2 picograms per month will have not at reduced risk for prostate cancer recurrence. The impact of this assay is huge for the urology community and for the prostate cancer patients that will be monitored with this assay. Currently, when patients are operated on by their physician, more pathology is found than was usually anticipated based on clinical staging. So these patients that are found to have additional risk factors for recurrence are typically managed very, very closely by their physicians, and if the patient is younger, adjuvant therapy is generally recommended to control potential recurrence. Our test will show that such patients, despite having adverse pathology, are actually at a low risk for prostate cancer recurrence based on their ProsView slope, as we call it, or rate of rise of PSA. This also has benefit for the patients in that they will be spared the unnecessary additional treatment that may not be necessary for them. It also gives both the patient and the physician peace of mind, and may allow the patients and physicians to be monitored less closely. Also for patients who have been operated on for prostate cancer, frequently they have difficulty getting health insurance due to the fact that the pre-existing clauses in these policies prevent them from basically getting insurance for more than 5 years after they have their cancer removed. By having a negative ProsView slope, that will give everyone assurance that the patient is cancer-free, at least for the first 8 years following radical prostatectomy, which was as far as we followed the patients in our clinical study. As far as the impact on, I'm sorry, I'm pausing here. I'm losing my train of thought. I think I've said enough on that. We'll go to the last question.
Cost savings.
No cost savings. Additionally, by avoiding unnecessary therapy for patients who do not need it, that saves the healthcare system a tremendous amount of money. It's estimated that more than half of the patients who receive adjuvant therapy do not really need it, based on data that's been published in the literature. As far as the activities that we're doing here at AUA, we have a booth. We have had a lot of meetings with large urologists, urology groups, and patient advocacy groups. We also have a dinner planned for this evening by our principal investigator of our 510K trial, Dr. Judd Mile, who will be introducing the assay to physicians and answering questions and presenting some case studies of patients that would are examples of patients that would benefit from this monitoring or this diagnostic test.
And if they want to learn more